Well, this fear that the Lambda variant of coronavirus might be resistant to vaccines comes from a paper written by scientists from the University of Chile. It's important to remember, though, that paper has not been peer-reviewed yet. It's not been officially published, so it can't be taken as official clinical guidance. It also only looked at the effectiveness of one vaccine, CoronaVac, not the other vaccines currently in circulation and that have been approved for use elsewhere in the world. However, if it is found to be correct that this Lambda variant, also known as C37, is resistant to vaccines, that's going to throw a spanner in the works for a lot of countries that are seeing their vaccination program as the way out of restrictions, of lockdowns, out of this pandemic. The Lambda variant, also known as C37, is highly contagious. Experts in the UK say it's got unusual mutations, but they're not quite sure yet how much of a threat that makes it. It has been responsible, though, for 80% of coronavirus infections and cases that have been confirmed in Peru. It has spread rapidly to around 30 countries around the world now, and 8 cases have been confirmed here in the United Kingdom, according to latest government data that leads up to the 30th of June. However, that should be put into perspective, really, given that in that same week, the 7 days leading up to the 30th of June, 50,000 cases of the Delta variant were confirmed. And Public Health England has also said there's currently no evidence that this variant causes more severe disease or renders the vaccines currently deployed any less effective. Around 50% of the UK population is now fully vaccinated. More than 79 million doses of vaccine given out across the entire demographic. And the government is really hoping that that's going to allow a planned reopening of the economy here in 2 weeks' time. But they'll be monitoring the figures very closely, and it won't be confirmed at least until July the 12th. Laura Makin-Isherwood, SABC News, London.